Good morning, everybody. It is time for Talk Radio for Entrepreneurs, and we are brought to you every Tuesday by the Women's Business Center of North Alabama. We are on WTKI 1450 AM and 92.9 FM in Huntsville and 1490 AM and 94.7 FM in Decatur. Tell your friends to tune in also. We always have some great guests on here. It's always so interesting to find out how people get into their business. I'm just always intrigued with all of these different industries and the guests that we have. By myself today, Darren has some early morning business, and so I am solo. My guest, I'm very excited about it. We actually are friends. I see him in many circles, and just when I came in this morning, I found out we go even further back because we've got some friends in common. Some of my best friends that are in the Athens and Shoals area went to school with him, Jim Pride, Director of Public Relations at Good Samaritan Hospice. How are you, Jim?
I'm doing fine, Mary Ann. Great to be here.
I'm so glad you're here. Well, so tell me, how long have you been with Hospice?
I've been with Good Samaritan Hospice about 4 years now.
Okay. And what brought you to this place?
Well, it's kind of an odd pairing, I guess. I was fortunate to be raised in a family business in the Shoals area. Mm-hmm. After basically all of my working life in that business, I sold out in 2006. Like a lot of folks at that time, had 2 kids in college, so that will motivate you to get up in the morning and get to work. Had a friend of mine whose wife worked for a hospice company, said they need somebody to do some marketing. Would you be interested? So that's how I wound up in the hospice business. Mm-hmm. So I worked for this hospice company for several months, and they had some financial difficulties and closed their doors. And one of the ladies who I had worked with at this hospice, Janet Melton, mm-hmm. Purchased a hospice here in Madison. And she called me one day and asked me would I be interested in coming to Madison to go to work. And I said, sure, because I really liked Janet and wanted to work for her.
Mm-hmm. That's great. And so what all do you do for them?
Well, public relations, of mm-hmm, course, mm-hmm. is a big part of what I do. All of the networking in the community with both chambers, with BNI, which is Business Networking International. I coordinate their advertising and then do some marketing also.
Well, and I know that you do a really good job because obviously you're out there and I see you a lot of different places, so you're highly visible and your company's highly visible too in the business community and the just the regular community of Huntsville, Madison County.
Exactly, mm-hmm. And that's what we want.
Mm-hmm. Well, tell me a little bit about, and we're probably going to go to break in just a little bit, but go ahead and let's bring us in on a little bit of the background on Good Samaritan Hospice.
Well, Good Samaritan Hospice, Janet Melton, who is an RN who I worked for, and her business partner, Kevin Hurd, who is a local attorney.
Mm-hmm. I know Kevin.
Okay, yeah, perfect. Okay. Even more. The opportunity came to purchase Good Samaritan Hospice a little over 4 years ago. Mm-hmm. Janet had been in, as I said, was an RN for 20 years and had been in hospice work for 6 to 8 years and knew that this was a calling.
Right.
So when this opportunity came up, they jumped at it. Went to work up here about 4 years ago and have built the company from nothing to quite a player in the hospice industry here.
Now, what area do you serve?
We serve all of North Alabama.
Okay.
Basically from the Mississippi state line to the Georgia state line, and as far south as Coleman County.
Okay, so out of this area, you have people that, are they living and working in those areas, or do you send them out on like a case-by-case basis?
Yeah. A little of both.
Okay.
We do. We have employees on both sides of the state, but we are centered, our office is here in Madison.
Okay.
And that's where everyone works out of. But we do have nurses and staff in the eastern part of the state as well as the western part.
Okay. Wow. And in this location, how many employees, full-time employees are there?
We've got about 31 full-time employees.
Okay. Wow, that's really interesting how it all started too, mm-hmm. because it certainly comes from a place of knowledge and experience.
Exactly, and from the heart.
Yeah, I mean, and that really makes a big difference in a business, because sometimes there are people that will decide, I'm just going to open this business, but they don't actually have any background in it, but the fact that Janet, that's her passion or love and her expertise and education, she comes from a very experienced place.
That's exactly right, Marianne. It is from the heart. We often say that, particularly our nurses and CNAs, this has to be something that comes from your heart, because there's not a check big enough for these folks.
Right.
They are pillars for their families and their patients. And then when they come back into the office, quite oftentimes you'll see the weight on them and how it does wear on them.
That's got to be tough, and it takes a very strong and particular type of personality to be able to be in that industry, because you're dealing with, ultimately you're going to be dealing with loss.
Exactly, you're
and
dealing
helping
with
the families.
Death. Yes, and it takes a very special person to do that on a day-to-day basis.
Well, and when we get back, I'll share. We went through that, and it's just we appreciate the people that are in that industry that are able to not only handle it on the professional side, but also on the emotional side as well. So, before we take a break, I want to shoot your website out there is www.gshospice.net. We will be right back with Jim Pride. Stay tuned. And we're back with Talk Radio for Entrepreneurs. This is Marianne Wyndham, and I'm talking with Jim Pride today, Director of Public Relations for Good Samaritan Hospice. And let's go ahead and get into it. Tell me why, how, what services, who's looking for you, and what do you provide for them from beginning to end? Okay. In a nutshell, tell me your life story.
Well, hospice is quality, compassionate care for individuals who are facing a terminal illness. Good Samaritan Hospice, we will provide expert medical care, pain management, emotional and spiritual support. We tailor all this to the patient's needs. Some patients will need quite a bit of services, some not so much, but we tailor this to each individual patient. Of course, when we first admit the patient, they may not need as much care as they will towards the end.
Right.
But it's all done according to the patient's needs and wishes. And the family and caregivers, because we're often told that the families feel like we did as much for them as we did the patient. Right.
Well, and I shared with you, I'll be 51 this year, and my age, our era, we're going through this right now, but it's not that I'm at a point where I can stop working. So for people that are caring for their parents, this becomes so important. You become a member of the family almost, because it's in the how do you juggle all of this and have to still maintain your career and take care of your sick loved one.
Exactly, and so when we admit a patient into hospice, we have a complete team that looks after this patient and their needs, from our medical directors, who are Dr. Zia Hassan and Dr. John Wagner. Then each patient is assigned a case manager who is an RN. This case manager, along with the patient and the caregiver, will set up a program according to the patient's needs. Now, this will include, of course, regular visits by the RN. We have certified nursing assistants who assist the patient in their personal care, be this bathing, bed changing, those types of things, as well as some light housekeeping and some meal preparation also.
How would somebody go about it as far as when they get to a point where, like I shared with you, my dad had a stroke, and then that care, the therapy, was not really working, and then he ended up having cancer. And at what point, like when it first happens, or when?
Well, we certainly believe that when an individual is facing a life-limiting or terminal illness, there's a point where the focus moves from curative care to palliative care,
right.
which means that the patient's primary physician feels that if the patient's disease runs its normal course, that the patient will have 6 months or less left to live.
Right.
We feel like at this point it's always important for that patient to get as much quality out of the remaining days that they have, days, weeks, or months
right.
that they have, rather than worrying about going back and forth to the doctor, this sort of thing, treatments that aren't going to help, to focus on what's important to them. If they're able to travel, if they're able to get out and go places and do things, we encourage that. It's just a good time for them to have with their families.
Right. Well, I mean, then what happens as far as the services that are provided, and where do they go? People can go on site, or
yes. Yeah. Well, we provide our services wherever the patient calls home.
Right.
Be at home, in an assisted or skilled nursing facility, wherever that patient's at, we can provide services to them. And usually, what will happen is there will be a consultation with their physician. And the physician will tell them that he does not believe that further treatment is going to extend their life.
Right.
At that point, that's when you need to look to hospice. Now, what will happen is the physician will issue an order to evaluate, which is similar to a prescription, that just allows Good Samaritan Hospice to come out, to speak with you, and to evaluate the patient to see if they meet certain criteria for hospice care. That is the very first step.
That's for people, and we went through this, and I'm sure we'll continue to go through it. We're not medical experts. The family members don't know, and it can be so overwhelming depending on the circumstances that really for people right now, I think a lot of people don't realize that they actually have a choice. When people are coming at you and you happen to be taking them to, a doctor, or they're going into emergency room, what is it? I mean, that they actually have a choice of what the care can be for their loved one.
Absolutely, and that's a very important part, because hospice care is all about patient choice. So you will be able to choose which hospice provider you use. You will be able to choose which services that you take advantage of.
Right.
And one of the most important that I failed to mention earlier is our chaplains.
Right.
We have two great chaplains, Doug Simons and Keith Lorick, who quite frequently become part of the family.
Right. This is so great. Hey, phone number 256-772-8108. We'll be right back. We're back with Talk Radio for Entrepreneurs. This is Marianne Wyndham, and my guest today is Jim Pride, Director of Public Relations at Good Samaritan Hospice. And when we left before the last break, we were talking about the different services that you provide, and you said that you've also got chaplains on staff.
Absolutely. We've got two wonderful guys that their contribution to what we do is immeasurable. We have Doug Simons and Keith Lorick are our chaplains. They go out and visit with the patients and their families. Sometimes the patients are not interested in that at first, and then so the guys just go and they don't try to preach to them or anything like that. They just go and talk to them, listen to them, let the patient tell them what they want to say, and more oftentimes than not wind up being great friends of the patient and the family.
That's so great.
I can't tell you how many times that both of these chaplains are asked to perform the services for the patient when they do pass. That's how close they grow to the family.
Yeah, that's so neat. I mean, that's important too, because
very important.
That's a very strong, important relationship that they've meant a lot to the family and over the duration or the course of this process for the family.
That's exactly right. And one of the important things, too, is that when the patient passes, we don't just drop the family. We provide bereavement counseling and services for up to 13 months.
I did not know that.
After death.
Wow.
And this includes, cards, phone calls by the chaplains, basically however much support the family needs. And once a month at our office, at the Good Samaritan Hospice office on Hughes Road in Madison, we have our bereavement support group. We've got several families that still participate in this, and it gives them an opportunity just to come in, to share their feelings, to share their memories about their loved one. And one of the great things about this service is you do not have to have been served by Good Samaritan Hospice to enjoy this service.
Okay.
Anyone who is suffering from the loss of a loved one is more than welcome to come. We meet once a month on the third Thursday of each month. Of course, you can call our office for complete details, and anyone is welcome.
That's so great. That is so great. So, and the other services, let's get into some of the other services that you provide.
Sure. Well, we have, of course, social workers to assess the psychosocial state of the patient, and quite often to help them navigate through all of this, whether it's with Medicare, Medicaid, or private insurance.
Right.
They will, and quite often have helped the patients find benefits that they did not know they were entitled to.
Right. Because, I mean, it really is like a big puzzle. It's
really
very
is.
confusing.
It's very confusing under normal circumstances, but then when you're dealing with a terminal illness of a loved one, it compounds that.
Right. And that's the big question also is like, you know, well, we need to talk to somebody. Are they going to charge us for a consultation? How do we pay for this?
Absolutely, and that is a great question. First of all, Good Samaritan Hospice is happy to come to anyone for a no obligation consultation. We will tell the patient and their families just what we can do, the services that we provide. So it's and also, it's important to note that you do not have to wait on your physician to suggest hospice care. This is something that the patient and or their caregivers can mention to the physician, or can call Good Samaritan Hospice on their own, and we'll take care of the rest.
So referrals, I mean, when you get referrals from people just from anywhere, right? That if they know somebody that's going through this, they can refer you. I mean, it can just be a friend referring.
Absolutely. Friend, family members, caregivers, anyone can refer a patient for hospice. As I mentioned earlier, we do have to have permission from the patient's primary physician in order to evaluate them from hospice services. But most physicians are happy to give this opportunity. It's similar to a prescription,
right,
where they just write an order to evaluate. And
so if this, you know, if I was going through this again, I could actually come to you and say, we're interested in working with you, and then tell my doctor or the family physician, say, we are interested in working with Good Samaritan Hospice.
That's exactly
and basically
what you
they'll
would do.
Go ahead and say,
yes, that's exactly what you would do.
Okay.
You would tell them that we've sought advice from a hospice provider. We've chosen Good Samaritan Hospice to take care of our loved one. We would like for you to give them permission to evaluate.
Okay. Yeah, I mean, that's really the confusion. It's just not being in the medical profession or anything that has to do with it. I think, and I'm saying just what we went through is the not knowing where to turn, and then also not realizing that, you know, we really do have a choice, you know.
Exactly. And one of the, I guess I find it a little strange, I probably shouldn't, but I have been told by nurses, nurse practitioners and things like this, that even the physicians themselves who are trained are still reluctant to tell the patient, we've done all we can do.
Right.
You need to seek hospice care.
Right.
So I think that, you know, it's incumbent upon the families to educate themselves and to know when this time has come. Right.
Well, and it's amazing, too, because how knowledgeable. I'm just amazed because I'm saying what we went through and towards the end, how close they know. And I hate to get on a sad note here, but really within 24 hours of when my father was passing away. I mean, they, by all the signs and everything, knew, and we were able to, they just helped us to prepare,
Exactly, and that's a big part of it. These nurses are trained and educated in this, and they can help the family through this. So when certain things do happen, the family is not shocked.
Right, and they can tell us it's the process. They're explaining the process. They're
explaining the process of dying.
Yeah.
And so the family is not as shocked. They know what to expect. And they know that one important thing with hospice is we're only a phone call away, 24 hours a day, 7 days a week, 365 days a year.
Right.
We can be at a patient's house in less than 60 minutes, 24 hours a day. All the family has to do is call us, and we're there.
Great. And so the website, too, the gshospice.net, can people find more information? Are there forms on there? Can they go in and...
Well, what we've got on the website is just a lot of great information about hospice in general, and about Good Samaritan Hospice, of course. You can check out the website. Of course, it's got all of our contact information on there. If you see something you have a question about, you need some clarification, feel free to call us. And one of the great things that I want to be sure and tell your listeners about that sets Good Samaritan Hospice apart from other hospice providers is that we are locally owned and operated. As I said earlier, we're owned by Janet Melton and Kevin Hurd. Janet is the clinical director and oversees the day-to-day operations of the hospice. There's no board of directors to worry about. There's no corporate web to navigate through. The owner is there on the premises every day making the decisions that affect our patients' care. Patients' families, they know they can call Janet.
Yeah.
They can, if there's an issue, something they need clarification on, the nurses will usually take care of this, but if they need to talk to Janet, all they do is pick up the phone and call because she is patient-oriented, and this is her call.
It's her industry. I mean, she's
Absolutely.
not like in an administrative role, and she doesn't know, what everybody's doing because she's actually been there firsthand.
Absolutely.
Yeah. And that makes a huge difference.
It makes a very big difference. All hospice providers will basically provide the same services, but there are a lot of little things that we do for our patients that perhaps you might not get reimbursed for, but that's okay. If the patient needs it, we're going to provide it.
Right. That's so great. I look forward. We'll be back in just a little bit. Again, the number is 256-710-0810. It's gshospice.net, and they're at 540 Hughes Road in Madison. We'll be right back. And we're back with Talk Radio for Entrepreneurs. And as I mentioned, we are brought to you every Tuesday by the Women's Business Center of North Alabama. That organization is located on the 3rd floor of the Chamber of Commerce in downtown Huntsville on Church Street. And they provide all kinds of services. In fact, I am a client. Our business is a client. You can sign up to be a client and be coached. Go to all of their networking events and their classes and their seminars. You can get on their mailing list. Go to WBCNA.org and sign up so that you get notification of everything that's going on. And we have Beverly Pike on the air with us to tell us what's coming up. Hey, Beverly.
Good morning.
How are you doing? What's going on this week and this month and beyond?
Yes, always. We're always providing the training programs to help strengthen your new business or growing business, their foundation or their path that they're trying to work on. So what we have this week, we have tomorrow, the 17th, our government Government Procurement Assistance Center is offering a government contracting essentials program that's continuing. It's not inclusive, so you can just jump in at any time. And our next two that are coming up, starting tomorrow, is a beginning proposal capture management class from 1 to 5.
Okay.
And so if your company is doing business with the government, or if it's not, this is a great opportunity, a great class to learn about proposals and how to capture them and what to look for and a lot of tidbits on that. Okay. Next week is the advanced proposal capture management class from 1 to 5. So they're on Wednesdays, the 17th tomorrow, next week the 24th. Now, one of our sponsors, Bid Designs, is presenting this class, Brent Paris. Mm-hmm. So that is going to be valuable information. We want to also recognize our other sponsors for this program was Teledyne Brown, DeCosimo, and VCSI. So that's been a super program so far, well attended, great information.
Okay.
And we have our Strong Coffee, Strong Women scheduled for Tuesday the 30th. We have Penny Billings as our guest, and she is giving her expressmonial on how she got where she's at today as president of Bancorp South. And that starts at 7:30 a.m.
That's great. And you know what? I never get to go to that because it's the same time as this Tuesday morning radio show, but Darren's going to be he's going to be solo that day so that I can actually come on the 30th. So I look forward to that. Yeah, I've been missing it. So we look forward to it.
Go to our website and register through our website through our calendars. And I just want to mention another thing coming up in May. We are narrowing down a date. Beeson and Nally is going to do a hands-on QuickBooks class.
Okay.
So that's going to be a hands-on class, so it's going to be wonderful.
Thank you so much, Beverly. We'll be looking forward to that, okay? And we are back with Jim Pride, Director of Public Relations with Good Samaritan Hospice at 540 Hughes Road, Madison, gshospice.net, and that phone number is 256-772-8108. And again, just a reminder, how do we pay for hospice?
Well, that's one of the great things about hospice care is there's never a charge by the hospice provider to the patient or their family.
Okay.
Hospice is a federal benefit. It is paid for through Medicare, through Medicaid, and also private insurance.
Okay.
But the most important thing for everyone to remember is there's never a charge for hospice by any hospice provider.
Okay.
So don't let that stand in the way of calling Good Samaritan Hospice.
I mean, I think that's one of the fears. It's just the knowledge. And speaking of that, I was asking you at the break, you actually will do presentations?
Absolutely. A big part of my position at Good Samaritan Hospice is a community educator. Mm-hmm. I will speak to church groups, civic groups, business groups, basically whoever would like to learn a little bit more about hospice. We also offer CEUs for nurses.
That's great.
And social workers. We're happy to come in and do this on lunch hour or in the afternoons, whatever works best for the office. We do a lot of these at skilled nursing facilities or nursing homes.
Okay.
We can do it there also, but we just like to get out and try to educate the public on exactly what hospice is.
And you also said something about CPR.
Oh, absolutely. We offer CPR recertification or certification classes for healthcare professionals. This is, again, something we can come into the office and do for the office. We do not charge for this service. So we would welcome anybody to call us and talk to us about that. We'll be happy to set up a time to do that.
And pretty much with all of these things, it's by their schedule. It's by their request, right?
Absolutely. Absolutely. We're available whenever we're needed.
That's so great. Any other closing words as far as not only just hospice, but kind of how you get your name out there and referrals and all of that, the networking that you do?
Well, absolutely. I'm involved in both chambers. I'm on the board of directors of the Madison City Chamber of Commerce.
Okay.
I'm involved with the Heritage Network chapter of BNI. And we just try to get out among the community, let people know a little bit more about Good Samaritan Hospice and hospice in general.
I meant to ask you, too, are y'all on Facebook?
We are. Yes, we certainly
I always
are.
ask that because, I mean, Facebook has been huge for Wyndham Entertainment and Wyndham Travel and Leisure. What is when people type in, what do they type in?
Just type in Good Samaritan Hospice.
Okay.
And you can like us there on Facebook, keep up with us. We try to post some little tidbits on a daily basis, just little pieces of advice.
That's great. Do y'all post like weekly, daily? I'm always curious just about how much activity other people do.
Well, we would like to say that we do it daily.
That's hard to do.
It's hard to do, but certainly weekly.
Yeah. You know, I took a class on the social networking, and they also say if you post a picture, just any kind of picture, and then comment on it, it's more viral, that people will see it more or like it, and then it kind of spreads it out there. I'm learning more and more about how to, to use that, because then when people share it, it makes people click on it and then go like the page. It just
absolutely, and I think you have to be careful about posting too much, though.
Right.
I'm sure all of you who are on Facebook have seen folks that just constantly posting one thing after another. After a while, you don't look at it.
Well, after a while, they end up being blocked.
Yeah. Exactly.
And again, just where is the location near?
Well, we are in the Madison Medical Plaza at 540 Hughes Road.
Okay.
That is just a little bit north of Browns Ferry Road, and I always tell people it's next to Lawler's Barbecue.
That's what I wanted to hear.
You can't miss us.
That's a good landmark to look for. Okay, we've been with Jim Pride, Director of Public Relations at Good Samaritan Hospice. Thanks so much for coming. I enjoyed having you on the show. And everybody remember, get personal, create success. We'll see you next week.